In Gaza, the healthcare crisis is worsening. The WHO has described the situation as dire and perilous. The largest hospital in Gaza, the Al-Shifa hospital, is no longer functioning and fatalities among patients are rising as a blistering Israeli assault continues in the Gaza Strip. A total of 5 premature babies, 7 critical patients have died at the Al-Shifa hospital as per reports from Hamas officials. Doctors are having to use flashlights on their mobile phones to treat the patients. On the other hand, Israel remains adamant on clearing out these hospitals and rejects the idea of a ceasefire and even tactical pauses to facilitate aid deliveries. What is the end game here? And as the death toll and humanitarian crisis continues to mount, are Israel's operations in Gaza justified? To discuss this, we have with us Irina Sukuman, who is a West Asia analyst and a human rights activist, joining us live from Washington, D.C. Ma'am, thank you so much for joining us.
Thank you.
Ma'am, to begin with, the Al-Shifa hospital, as I mentioned, it is no longer functioning. What is the situation currently when it comes to healthcare in Gaza? What's your assessment?
Well, there are two separate issues that we should look at. First, the fact that Hamas, that controls the health authority, is not credible at all. From the beginning, it distorted and misrepresented and outright fabricated information concerning health data. We have seen that it completely lied about the source of the attack on the Al-Shifa hospital and the number of victims in the early stages of the war. And Hamas can simply not be trusted to be an accurate assessor of data regarding deaths or other health-related claims. But aside from that, there's also an issue concerning fuel. It may very well be true that hospitals are suffering from fuel shortages, but Hamas has been amassing huge amounts of fuel, and instead of delivering them to the hospital, has been using them entirely for attacks and war efforts. It has also lied about the quantity of fuel available to civilian institutions, claiming that they would run out in the first days of the war. Over a month into the war, despite the fact that there are shortages and limitations, the fuel has not completely run out. So it's very hard to determine the extent of the crisis. All we know is that Hamas bears full responsibility for it and has all the incentive to misrepresent the situation to the international community.
That being said, infants, premature babies, it's getting harder to keep them warm, provide the care that they require at this point. But Israel's hunt for Hamas militants continues. Its operations in Gaza continue. What are the options that the civilians in Gaza are left with? Do you think there will be any respite in light of the fast deteriorating situation?
Well, Israel has allowed for 4-hour humanitarian pauses each day, and it has allowed for safe passage to all civilians, provided they indicate that they are in fact civilians, such as by waving a white flag or giving other indication that they are civilians. It's a daily situation that, according to even international sources, has allowed the majority of civilians to evacuate from the affected areas immediately under siege from the Israeli sources. However, Hamas has been actively trying to prevent that from happening and blocking the passageway. There's been reports of Hamas shooting at civilians, trying to evacuate either to other parts of Gaza or to the Rafah crossing where they would have a passage to Egypt.
All right. In fact, I was just going to come to this just for better understanding here. Washington did, in fact, say that Israel had agreed to the tactical pauses, as you mentioned as well, the 4-hour pause. However, Netanyahu seems to be not in favor of such a pause in fighting and, of course, has completely rejected the idea of a ceasefire. So do you think there will be a pause anytime soon? If, in fact, there are these 5-hour pauses, do you think they will prove to be effective even temporarily?
Well, Netanyahu was correct in rejecting ceasefire because a ceasefire would merely allow Hamas to rearm, regroup, and continue its attacks, as it has been, in fact, continuing to attack Israel with rocket fire. But the humanitarian pauses have continued despite criticism from Netanyahu. And as I said, they have been effective in helping the civilians evacuate to the extent it's possible, given that Hamas's own actions have been a hindrance. The rest is all entirely dependent on Hamas, which has refused to release the hostages that they have captured from Israel, or to make any other concessions that would allow Israel to maintain security over its own borders or over these hostages. Unfortunately, Hamas has prevented its own civilians from receiving the help that they need. It has also been blocking the distribution of humanitarian aid. Israel has not been a hindrance. It has allowed airdropped from Jordan, and as well as delivery of trucks from Egypt and other places.
Right. Talking of the hostages, Prime Minister Benjamin Netanyahu did mention that there may be a possible deal. However, there aren't any further details on this. On the other hand, we see that the mediation efforts have continued. What can we expect on that front when it comes to hostage release?
That's very hard to say. And again, the ball is entirely in Hamas's court. We do know that we have heard weeks of discussion with various deals supposedly falling through at the last minute. And it's hard to say whether Qatar, which is a mediator in these negotiations, has been a reliable mediator, or whether it has been deliberately helping disrupt Israel's war effort and attempt to bring to a halt military operations under the pretense of a possible hostage exchange. Regardless, nothing has materialized thus far except for psychological warfare hostage videos, and there is still no proof of life for the vast majority of the hostages from Hamas.
Coming back to the hospital crisis in Gaza, the medical staff is scrambling, having to use flashlights to operate on patients. Ambulances have stopped evacuating people for treatment. Infants have died in this devastating war. Diplomatic efforts seem to have done little to change the situation on ground. What will it take for there to be a ceasefire, for aid deliveries to be restored in Gaza? Do you think it's perhaps time for Israel to look at other options to weed out Hamas militants?
I think the only option in this case scenario is for Hamas to give up, or to be ousted, or otherwise to be militarily destroyed. Those are the options. Israel will not allow this territory to be destroyed again. And by the way, should Israel withdraw its ground forces from Gaza and rely only on the airstrikes to try to weed out the Hamas operatives, that result in far greater casualties among the Palestinian population. In fact, Israel is putting its own troops at risk by having them go through these ground operations, through these tunnels that will be trapped, and losing individual soldiers that would not be the case had they relied only on airstrikes. But they are trying to minimize civilian casualties. They have been issuing repeated warnings before airstrikes and have given ample time for civilians to evacuate. No other conflict in the world would have been calling for humanitarian pauses, and certainly not for ceasefires against an active enemy that is determined to destroy Israel as a state, and has gone on public record asserting that they would repeat the same attack as on October 7th again and again if they have any means to do so.
All right. Ms. Irina Sukuman, thank you so much for joining us on WION with your insights and perspective on this.
Thank you so much. Appreciate it.